Without raising any form of panic at all, maybe we all ought to know what the signs and symptoms are to watch out for. Dr. Veena Babu joins us. Hello, hi. Thank you for being with us all morning, actually. This is really serious health message, isn't it? Because we mustn't panic, but we should know what to look for.
Yeah, absolutely. As we keep saying, knowledge is power. And I think in a situation like this, when numbers are going up, we're seeing young children being admitted to hospital. We've lost some lives, unfortunately. I think as parents, if you have young children, be aware of what the condition is, how they present, and take action as soon as possible.
OK. It's not always that easy to take action, though, is it? This is part of the problem. It's when to try to get an appointment and if you can get an appointment.
Yeah. So I think what we've been saying all morning, look, feel and feed. So think of these three things when you're looking at your child. Do they look unwell? Are they a bit dehydrated? Are they a bit more drowsy than normal? Feel them. Do they have a temperature over 38 degrees? That means they have a fever. There's an infection in the body. Are they feeding? Is their nutrition going down over, say, a 6 or 12-hour period? These are parameters parents can use at home. And then there are additional signs of if the tonsils are enlarged, because Group A strep can, as we know, it's common. Winter months, lots of children mingling with one another. It can present as tonsillitis, as you can see in the image here.
Now it's worth pointing out as well, the tonsils are the bit on the side, not the bit dangling down the middle.
Swollen two little balls on the side of the throat. The dangly bit is called the uvula. When you see white dots on the tonsils, that's what we call pus points. When there are pus points...
that's a sign of infection?
That's a sign of bacterial infection.
Right.
Yeah. So when you have a viral infection, tonsils are just enlarged and red. But when you have the white dots, we know it's a bacterial infection.
Right.
So if that happens, alongside eating cool, soft foods, you can get Diflam spray from any pharmacy that will help numb the throat, at the back of the throat, so you can eat comfortably. You don't need a prescription for that. But for antibiotics, of course, you need to see your doctor.
Yeah. I mean, but that's a key sign, isn't it? If you've got a bacterial infection, antibiotics will treat it.
Yes, it should do, yeah.
Right.
So you have the strep throat, which presents like that. Then if you present with a rash on the body alongside that and the fevers, is when we have to worry about scarlet fever. Because
now this is what I look like as a boy. So that's scarlet fever on white skin.
Yes, on white skin, it's obviously quite red and raised. And when you press along it with a glass or your hand, it should blanch, which means it should disappear. On darker skin, it may appear as bumps, which almost looks like a prickly heat rash if you look at it. But that's how it appears. It's what we call the typical sandpaper rash. So this, in combination with some children having a swollen, beefy tongue, what we call a strawberry tongue, is typical of scarlet fever.
Right,
again,
let's have a look at that.
Yeah.
And again, there's that sort of white discharge.
The white discharge isn't always there, but you see the red, big tongue. And parents often say, children complain that they can't taste or they're not very happy with what they're putting in their mouth, and that's a sign enough, really. So we could do a swab of the throat, but the key is starting antibiotics quickly. Another form in which strep infections present is something called impetigo. Have you heard of that at all?
Yeah, it's a skin problem, isn't it?
Yeah, so it's a skin problem which presents with typical honey crust lesions around the mouth or the nose. If it's just a few of these kind of blisters that dry up, we can give topical antibiotics, which is a cream. But if they're widespread on the body, you should have oral antibiotics.
Okay.
These can occur around the mouth, around the arms, around the legs. It's easily treatable, but very contagious. So you want to wait till it crosses over. Don't mingle with a lot of children or pregnant women while you are unwell.
So if your children have any, or anyone has any of those sort of things, they should be alarmed enough to be able to see the doctor.
Yeah, so these are easily treatable causes. And what we don't want is, especially with the cases rising and the invasive part of the infection. So if we don't do anything, sometimes the bacteria can get deeper into the muscles or the organs. And that's when we have the more dire cases, like we talked earlier, toxic shock syndrome or necrotizing fascia, the more serious things, which, again, just not to alarm anyone, those cases are around 2 in 100,000, so it's not like we see it all the time. But if your child is not responding to antibiotics within, say, 24 hours of taking it, getting worse rather than better, you don't want to wait. You want to take
make a fuss, yes. Yeah,
right.
You have the right to. So the poor little girl who's still fighting for her life in hospital, What would have caused, and the 6 other children that we know have died of it, is it that where the antibiotics haven't worked, or they've, the symptoms symptoms were spotted too late, or what?
So it's tricky, isn't it? Because we don't know the background, the medical history, and in what case, what they were given. I know in one particular case, the child was given a steroid rather than an antibiotic, which is I can see why maybe the person treating them may have thought it presented as croup, which is very common in young children, and steroid is the key thing that we give to help reduce the inflammatory response. And I think that young girl or boy passed in their sleep at home, and it's just really tricky. It's tricky to say what happened in each case, but I think if you're a parent, being aware of these symptoms, looking at what the images look like, taking action if things are not improving is key, and I think that would be the best thing to say.
Yeah. So it's just about don't panic, just be aware of what you need to look out for.
And feel that it is your right to make a fuss if you're worried.
Yeah, absolutely. And I think as clinicians on the receiving end of this, things keep changing. We've been through a pandemic. We understand what panic does. We understand what worry does. But we also understand what it means to not take action, right? So if a parent is worried, it's warranted that we look at the patient, look at the child. So I'm sure your doctors will understand you're not going to be bothering anyone. Get in touch with your GP by e-consult, message, telephone, face-to-face, or 111. And obviously, if they're really unwell, take them to paediatric A&E.
OK. Veena Babu, been great to see you this morning. Thank you very much indeed.
Thank you.
So, yeah, just